Now, India has raised strong objections to the estimate given by the World Health Organization regarding deaths related to COVID in the country. According to the WHO, more than 47 lakh people died due to COVID in India between January 2020 to December 2021. But India's official records suggest that only 5 lakh people have died in the same time period. India raised strong objections soon after the WHO released this report. Indian government said that the validity and robustness of the models used for data collection are questionable.
Globally, we estimate 14.9 million excess deaths associated with the COVID-19 pandemic by 31 December of 2021. So this estimate ranges from 13.3 million to 16.6 million. There were 5.4 million reported COVID-19 deaths to WHO over this period. So this excess estimate represents 9.5 million more deaths, or 2.75 times more deaths than reported.
Now, last evening, my colleague Tamanna spoke to Dr. NK Arora, chairman of the COVID Sub-committee of NTAGI, as well as Dr. Naresh Trehan, the MD of Medanta, on this subject. Listen in.
The divergence in data, it's a very, very big gap. So who is not counting correctly, us or the WHO?
Very unfortunate the way WHO has put up these figures, although a lot of input was given to them. And it is interesting, a country who is able to manage 1.9 billion vaccine doses to the last and give electronic certificates. A country who has done over 1 million RT-PCR tests, and there is a record of everything. A country who has this CRS data sample collection, not for last 2 years, but for decades altogether, and highly credible way of collecting the data. And our data is not acceptable. They are talking about modeling exercise. Modeling is done when primary data is not available. We have primary data available, and there are innumerable publications on that. So this whole issue is something very unfortunate. It also appears, I do not know how many of us are aware that in this country, about 8 to 9 million deaths occur every year. What WHO is suggesting that almost 25% of deaths in 20 and 21 were due to COVID. It's unimaginable. It is laughable, I would say.
People died eventually because of symptoms caused by COVID-19, but at the point they died, they were no longer infected. The infection had passed. Could that process have led to underestimation because the final reason written on the death certificate may not have been COVID-19, and the courts did step in to try and correct that?
It's possible that we are off by, even if you go by 100%, that maybe there were double the deaths of that were reported, and maybe some were, or additionally, were erroneously reported as COVID negative, but post-COVID patients. So I think that this data that WHO has put out is actually out of the field, in the sense that their methodology is not clear. You take random pieces of information and collate it into something so preposterous as 4.5 million people died. That's not possible to hide or to miss so many deaths. It's not possible. And we saw it ourselves. Our death rate overall, including the terrible second wave, was much lower than the rest of the world. So this is real.
They can take the J&J vaccine, but otherwise they've essentially said that this vaccine should be avoided as much as possible.